Patient respiratory assessment. The 6 key parts of respiratory assessment are interview, observation, inspection, palpation, percussion, and auscultation. First, gather your equipment. You will need a stethoscope, pulse oximeter, and a watch with a second hand. Also ensure you perform hand hygiene and have a quiet and private room to perform your assessment. Begin with the patient interview. The interview's primary focus is to gain a patient's health history. To do this effectively, it is important to build rapport by making them feel comfortable and asking open questions that invoke a detailed response rather than a yes or no answer. Start an interview by ascertaining the patient's identity, introducing yourself, your role, and what you intend on doing. It is also important to gain the patient's permission before proceeding. During the interview process is when observation should occur. Observe for ease of breathing, rate and pattern of breathing, audible breathing sounds, and the position attained to breathe comfortably. Now is also a good time to take their oxygen saturation levels and pulse rate with the pulse oximeter. Begin physically assessing by asking the patient to lean forward, starting on the posterior chest so the patient can lean forward when they are less tired and lean back at the end. It's also good to complete one side before the other so as to not tire the patient by going back and forth. Inspection. Assess for contours and shape. The back should be symmetrical. Ascertain are the scapulas the same height, as this could indicate scoliosis. The chest should be a regular oval shape, not barrel, as this could indicate a sign of air trapping or chronic obstructive pulmonary disease. Also assess the use of intercostal muscles used to breathe. These should lie flat as the chest rises and falls. Assess their respiration while their back is turned and they are unaware. Check for 1 minute if regular and 2 minutes if irregular. This should be between 12 to 20 breaths per minute. Record before continuing. Palpation is the use of one's hands and fingertips to gently feel for abnormalities. Palpate the posterior thorax starting above the scapula, moving downwards, feeling each rib and intercostal space between the ribs. Whilst palpating, assess for symmetry, comparing the feeling and appearance to each side, musculature, feel for tenderness as this could indicate injury or another condition, and respiratory exhalation. Placing both hands flat on back at right angles to the spine, noting both sides should rise and fall symmetrically. Palpate vocal phragmitis using the flat edge of your palm as shown. Place the palm of your hand on each location in the diagram and ask the patient to say 99 each time you place your hand on their back. Start at the top on one side, going across to the next, comparing the vibration on each side. Percussion is the process of placing one's non-dominant hand on top of the chest and using the dominant hand to gently tap on top of the other hand as shown. Work from side to side down the length of the thorax to ensure you cover the entire chest region. Percussion helps to determine if there is any fluid in the lungs. When percussing, if the lungs are filled with air, it will sound resonant. When there is fluid in the lungs, it will sound dull, and when hitting bone, it will sound flat. Auscultation is the use of one's stethoscope to assess for normal breathing sounds. Using a stethoscope, have the patient breathe in and out each time you place it on their back. Listen from side to side, again comparing the sound to the same area on each side, working in a zigzag motion, ensuring no area is missed. The purpose of auscultation is to listen for adventitious or abnormal breath sounds. There are 5 adventitious breathing sounds: fine crackle, coarse crackle, wheeze, pleural friction rub or a low-pitched grating or creaking sound, and stridor, a high-pitched musical breathing sound caused by a blockage. Auscultation also needs to be done on the lateral sides of the chest, below the axilla in 4 places. This can be done from left to right side, alternatively, to compare the sides to each other. Now that you have finished the posterior side, complete the same process on the anterior side. Bear in mind that you will need to ask females and males with large breast tissue to lift or move this during the process so as not to interfere. You are now finished with the patient and can clean and replace your equipment.
Create completed using Powtoon.